Good afternoon. County Executive Rich Fitzgerald here, giving our weekly update on COVID-19 pandemic. We've actually seen very good progress since the last briefing a week ago. In fact, today we had a 3.9% positivity rate. That's the lowest it's been since the third week of June. So we're starting to see real progress as we saw those net numbers start to stabilize over the last few weeks. The orders that Dr. Bogan and her team put out in late June and then modified in early July have had an effect. And I think really it's been the folks in the region wearing their masks, keeping socially distancing, following the mitigating strategies that our health professionals at the federal, state, and certainly local level have given. So the cooperation has been tremendous. And obviously, as we start back into school over the next few weeks, both at the K through 12 and the college and university level, the challenge is going to continue as more people are out and about and have a potential for spread. So it is really, we went into the green on June the 5th, and then we saw those numbers spike about 2.5, almost 3 weeks later. And then since then, when the mitigating strategies came into effect, they stabilized and then slowly came down. And we do want to stay under that 5% positivity rate. For April and May and early part of June, we were in very low numbers, 2-3% off, and sometimes even 1%. And so, good work. People cooperating, supporting each other, supporting their family members, friends, etc. A couple things we did want to hit upon, though. I wanted to talk about some of it dealing with racial disparities. I've been hearing from some folks in the community, in our African American communities and communities of color, of some people not necessarily always wearing their masks. And just to look at some of the rates that we've seen, the positivity rate in the white community has been 7%, but in the the black community, people of color, has been around 12%. So obviously a higher rate. Hospitalizations have also been higher, 8% in the white community, 10% in the communities of color. Hospitalizations, again, and positivity rate higher. So we're really, everybody should be wearing their mask, but we certainly want to encourage communities that have had some health disparities certainly be helpful as well. We want to make sure testing is more accessible, and it has been, and more affordable. Partnerships with some of our HQHCs addressing that. Over 37% of the people in those in the FQHCs have been people of color. 30% of them been African American. And we recognize that people with underlying health conditions are at even an elevated risk for complications of COVID, and many of those conditions are prevalent in our communities of color. So we want to make sure we continue to stress the wearing of the masks, social distancing, and all the mitigating strategies, washing your hands that we've talked about. And we want to encourage our friends and our neighbors and our coworkers to do the same. We're all in this together. So, and also want to just let people know, if you need help with resources, masks, cleaning supplies, etc., consider reaching out to the organizations and agencies that serve your community for assistance. And if you need help because you're in isolation or quarantine, please let the health department staff know and call our COVID-19 hotline at 1-888-856-2774. We also want to stress, we understand that the impact of COVID and what it's done to all of us, regardless of where we are on mental health. The pandemic has been so stressful for so many people, and not just the fear and anxiety over the disease, but over all the other things that are occurring, economic, isolation, things that have occurred. We want to make sure that people know that there's help out there. Please, if you're in need, please call 211, the United Ways helpline, and they can connect you with organizations and services of folks that you may need. And finally, we want to talk again about the census. We've talked about this before. We're coming on a deadline end of September when everything's going to be done one way or the other. We want to make sure that everybody participates in the census. Now, nationally, the response rate has been 63%. At the state level, it's been 66%. And in our county, it's been 69%. So we're proud of the fact that we're doing better than the state and the country, but it's not enough. We want to get everybody counted. So there are going to be people If you haven't contacted by phone or online, there are going to be people coming to knock on your door. If you want to avoid that, please call and answer your questions. It's only 10 questions to answer. It's 844-330-2020, and a person will ask you those questions, or you could go online at 2020 Census, census.gov. But the folks that will be coming around in the neighborhoods, they'll be wearing ID, they will be wearing masks, they'll be keeping physically distanced from you when they ask you the questions. So please be polite to them and answer the questions, because having everybody counted allows us to access the resources for things like health resources, education resources, et cetera, that we have. So these are the things we want to make sure. We've been very cooperative in so many areas. We want to make sure that we do well in the census. So with that, let me turn it over to Director of the Health Department, Dr. Deborah Bogan, to give the weekly update. Dr. Bogan?
Good afternoon, and thank you for joining us again today. So we hit a nice milestone this past week. For the first time since cases in Allegheny County surged in late June and early July, the weekly average of new daily cases was below 100. And I'm so pleased with the hard work our community has put in over the last several weeks to reduce the spread of the virus in our community, which is reflected in the decline in our case numbers. So businesses, including restaurants, stores, gyms, salons, they've found ways to stay open and stay safe. Many of you are making decisions every day that keep you and your neighbors safe. You're limiting your trips out of the house to essentials like food, medicine, and exercise. You're wearing a mask when you go out. You're keeping your distance from others, and you're washing your hands or using hand sanitizer on a regular basis. And that is all great. Keep it up. Remember, these are the steps that we all need to do to keep both ourselves and our community safe. We all have a part to play in limiting the spread of the virus. And to those of you who have not joined this important effort, to businesses that ignore or even flaunt the public health orders and safety guidance, to people who don't wear masks, to people hosting large parties, and to those of you who are attending those parties, we really, really need you to get on board. The virus is not a hoax. It is not a rumor. Cases have been identified in nearly every neighborhood and municipality in our county. People are getting sick, and unfortunately, many have died. We've had 273 deaths in Allegheny County and nearly 7,400 in Pennsylvania. We need you to take this seriously. We need you to be part of the team, and we need you to be a good neighbor. Controlling the spread of this virus takes all of us. We must all work together. The reason I am stressing this today is because we are at a critical point in this pandemic. Our school season is about to happen. We would all like to bring children back to school for in-person instruction, but that is challenging if rates of infection are high in communities. This week, the state released guidance to help districts bring children back to school safely. The state suggested that schools consider two metrics when considering how they will reopen, whether all in person, a hybrid model, or all online. The two metrics are incidence rate and positivity rate, and these numbers allow us to assess the level of community infection and transmission. The incidence rate is the cumulative number of cases, new cases, over a 7-day period per 100,000 people. In Allegheny County, that number for July 31st to August 6th is 50.1, according to the state's COVID-19 Early Warning Monitoring System dashboard. That puts Allegheny County right in the middle of the moderate category for community transmission. The positivity rate tells us what percentage of tests are positive, and according to the state's dashboard, Allegheny County, the percentage for that same week, July 31 to August 6th, is 4.7%. And that puts Allegheny County at the upper end of the low community transmission category. Schools can use these metrics and other resources from us, the State Department of Health, the State Department of Education, and the CDC to make the best decisions for their individual schools and communities. Your part in all of this is doing everything you can to keep the spread of the virus under control. As I said, it really takes everyone. I also wanted to share some data that we're watching regarding testing, case investigation, and contact tracing. Regarding testing, the median turnaround time for both positive and negative tests in Allegheny County has improved dramatically. It is now 2 days. Testing turnaround time has significantly improved, as I said, and all the labs that run 50 or more tests are reporting their results within an average of about 3 days. This allows our case investigation team and contact tracing team to begin their work quickly. Regarding case investigation, the number of new cases that told case investigators they went to or work at bars and restaurants continues to decline. Reports of attendance at parties have dropped, but are now on par with bars and restaurants as the #1 place new cases report going to. We must continue our safety efforts in both of these areas. The number of new cases who reported playing sports increased to a level we haven't seen since late June or early July. The governor's office developed recommendations and guidance for keeping safe while playing sports, and I encourage everyone to follow that advice. Case investigators have been looking also at the number of cases connected to a previously known case or cluster. This gives us an idea of how much community spread we have. 10% of new cases were connected to a known cluster. These could be within families, workplaces, nursing homes, or other care facilities. 53% of new cases had close contact with a known case of COVID-19, and this suggests that about half of the cases don't know how or where they contracted the virus. This is why it's so important that we all remain vigilant and wear our masks. Our contact tracers continue to reach a majority of the close contacts identified by our new cases. Last week, contact tracers reached 83% of close contacts they had information on. We know, however, that this doesn't represent all close contacts of new cases. Recently, some new cases have declined to provide information on their close contacts. And we really need this information. It stays confidential. Close contacts won't know who identified them. No one did anything wrong, and no one gets in trouble. This is really just how we keep people safe. And sometimes the cases tell us that they have already talked to their contacts, and therefore we don't need to. And we appreciate that you reach out to your contacts, we really do, but it's important that we reach them ourselves to provide important information. Contact tracers provide information about access to services, tips for staying safe during quarantine, and much more detail. So they also provide an official quarantine letter, which may be needed to arrange time away from work. So I'm asking you to provide contact information to allow us to ensure the safety of our community. It has been nearly 5 months since our first reported case of COVID-19 in Allegheny County. We have been through a lot in those 5 months. I thank you all for the hard work, for sticking with it, and for being there for one another. So thank you, stay safe, and please be kind.
The first question that we have today is from Gazette 2.0. Kids ages 0 to 9 make up 2% of cases in the county, while ages 10 through 19 make up 7%. The numbers are very similar at the state level. Why is this? Are children less likely to contract COVID, or does it speak more to behaviors of these age groups, or are they simply not being tested?
So the information around children continues to change. The American Academy of Pediatrics and the American Children's Hospital Association put out a very nice report that I would refer you to with a lot of information about cases of COVID-19 in children. Children definitely can get it. They tend to have a more common, a less severe illness, but there are severe cases among children, but they're much less common. I think in the report it says that in the last month alone, 100,000 children have had COVID-19, so they definitely get it. The question is also, do they spread it less? That is controversial, and so I, again, refer you to that report for much more detail on what's happening in children in our country.
This next question is from the Post-Gazette. Given the county's own data showing very few people who tested positive reporting they were playing sports at some point prior to becoming infected, what do you think of the state's decision to strongly recommend that youth sports not be played until January?
So first of all, we have seen an increase in the number of reported cases from sports. But part of the reason is that we didn't really have a lot of team sports going on for a long time. So we're just really, it takes a while to get those reports. The challenge with team sports is it's really about trying to keep the virus contained. And so you can imagine if you're a sports team and you play you're amongst one another and you're sort of a cohort and you stay near each other, you would spread it within that small cohort. But every time you go play another team, you are bringing that, if you have somebody who's got it in your cohort, you're bringing it to another group, and it keeps spreading and spreading. And so the thinking behind stopping team sports isn't stopping sports, it's stopping the spread of the virus as you play team after team after team. So again, we've talked about podding, staying in pods, staying in cohorts, and that is a way to be social and to do sports, but to stay, keep it from spreading. So I am in support of the recommendations from the state for those reasons.
This next question is from multiple outlets and it's being asked in multiple ways, so I'll try to make it short and sweet. The Southwestern Pennsylvania Restaurant and Tavern Association has said that some bar and restaurant owners are discussing the possibility of opening up more of their businesses and essentially following the CDC guidelines but disregarding the orders that are in place from the state and the county. So we're being asked if that happens, whether the county's COVID-19 response team or other organization may, how they will handle it and what the county's response is to this possible restaurant revolution.
Sure that our county executive would like to comment, but I would like to just give a plea and a beg, please don't do that. It is a critical time. We are having schools returning. All of our colleges and college students are returning to town over the next couple of weeks. We really need to support our return to education, and the more community spread we have, the harder that will be. We have done such a good job. I know people are frustrated and they want to be out. I want to be out, but I am not going out. And I just think that the results will be that 2 weeks from now, we will have a huge problem on our hands. And so I implore you, from a public health perspective, that would just be a huge nightmare for us all. And so to those of you who need social engagement, again, physical distancing is what we ask for you. We ask you to stay apart. That doesn't mean you don't need to be social. You can be physically distanced and be social without having huge parties. So please, from a public health standpoint, I encourage you not to do that. I'm sure the county executive would like to comment.
Yeah, let me echo the words of Dr. Bogan. We do implore you. We know the strategy has worked. What she has done and her team have recommended since late June, early July has led us to the point where we're now at a good place where the numbers have come down. If we reverse that, and we're going to go back up again, and now we start to put the rest of our economy at risk, because the one thing that Dr. Bogan and her team were able to do in just dealing with isolating where the contact tracing took us allowed us to keep retail, manufacturing, construction, real estate, automotive, salons, hair, gyms, et cetera, open. Our job is to keep people safe, and we're going to keep people. We're going to do everything we can to keep people safe. So the team has gone out there, and they're going to continue to do that. The law is the law. The state has put something down, and we're supporting them and supportive of that. So I would hope, we understand the pain and the stress that is putting on. But many activities have had to change. Offices do things remotely. Elections have done things, through mail. Our sports teams are playing in empty stadiums, but we're watching it on TV. Go patronize your restaurant. Please, go do takeout. Sit outside. Do the things to keep your restaurant employed. But we cannot have people going rogue and just deciding on their own that they're going to break the law. People might not like the speed limit on a certain road, but guess what? You got to follow the law. Other laws people may disagree with, but we've got to follow the rules. The state has put these in place in working with our local health department. So again, we implore people to do what we need to do, but we're going to do what we need to do to keep people safe.
This next question is from KDKA Television. Wondering if the county can update us today on the COVID-19 field response team and how their work is coming along.
Sure, thank you for that question. The COVID response team continues to be very busy. They have visited more than 1,200 facilities, and about 88% of them were following all of the COVID safety recommendations. We have sent out our food inspectors to a couple of challenging locations, and a couple have been closed. All of that information is available on our food safety website.
This next question is from the Post-Gazette. There have been reports that the Monroeville Rehabilitation and Wellness Center has an outbreak of COVID-19, with reports of 47 new cases in the last week reported to the state. Has the county health department been in contact with the center, and what actions are being taken to prevent further spread within that center?
So yes, we are aware, we've been involved, and also, as I think I mentioned last week, the state has put together some really important resources for long-term care facilities that have also been involved. And so I forget their long abbreviations, but both of the state resources are also being utilized.
This next question is from Public Source. What does the county know about the use of antibody tests locally, and how or if they factor into official counts at any point in time?
So we have been looking at our antibody testing in our county, and we have hundreds but not thousands of those tests completed in our county. They have been used, I think we explained this last week, that they're used under very specific circumstances to identify a case. They have to have both an antibody and had symptoms, and there's some other criteria. I understand the state may be changing how they count those or not. So when we get that information, we can share it with you.
This next question is from WPXI. Allegheny County's restrictions on alcohol sales remain tighter than the governor's order. With cases going down, is that something that will be reevaluated? Is there a certain level where you want to see the positivity rate before that would be changed?
Again, we're thrilled that the rates are going down. They're not as low as they were back at our low point. And schools are just about to reopen, and I want to sort of wait and see what happens with our school reopening before we make any decisions right now.
This question is from WTAE. Yesterday, Mr. Fitzgerald said the testing numbers are going in the wrong direction. Curious about what you can do to increase those testing numbers. Right now, those with symptoms, those with suspected exposures, and those who have traveled to hot spots are prescribed a COVID-19 test. Is there an ability to widen the umbrella of those who should get a test?
Well, we continue to adjust our recommendations based on what's happening in the community. Again, what I like to see is that if we have more cases, I want to see that our testing is really ramping up to make sure we're not missing people. And we continue to work on access. I'm really happy that our turnaround time of our tests has improved dramatically. And again, that makes me think that we're having better access for people, that we're getting a quicker turnaround. But we do continue to look for ways to expand testing access in our community, and I'll keep you abreast as we add new options.
This next question is from the Pittsburgh Business Times. What do the closed restaurants have to do to be able to be reopened, and have any of them made moves that would satisfy the inspectors in the health department at this time?
I assume that refers to the ones that are the field response ones, or the ones at the restaurant. Right. The restaurant inspections specifically. If you look at our food safety website, it lists what the violations were or what the reasons for closure were, and they have to address those in a written way, and that's how they address it.
This next question is from WESA, and probably for both of you. As a follow-up question to Mr. Fitzgerald's comments, there are social determinants of health that put Black Pittsburghers at higher risk for getting COVID-19. Besides telling people to wear masks and keep physical distance and wash their hands, what is the county doing to continue to address this disparity?
That's a very important question. First, we have tried to increase access to testing. We are working with DHS and other folks on getting resources to communities and continue to get the message out. But again, it is a systemic problem that relates to how you get to work, where you work, housing, and many other things that need to be addressed more longitudinally. So I don't know if you want to comment on that.
Yeah, I think Dr. Bogan addressed it, but also I think one of the things adding to that is the CARES Act funding that has come from the federal government that we were able to get. A lot of that has been deployed to some of our human service and United Way operations to try to reach people and help people with things like PPEs and other mitigating strategies to help in communities that have been affected. So using that funding that the federal government has come through with is also helpful, in addition to the things that Dr. Bogan had mentioned.
This next question is from the Gazette 2.0. Some school districts are starting the school year virtually, while others are opening up completely, but with students arriving or switching classes at different times. What are the dangers of opening up schools at this time?
So, I have been on lots of calls with the schools and the school districts, and I will say that they have all given this really careful consideration, and they are working very hard to balance the risks of not opening with the risks of opening in-person classes. And so, we know that that in-person education would be our preference for all children, and people are working very hard to meet that as best they can within the limits of their resources, their staff, et cetera. So the goal is really to keep people safe, both the children and the staff and our community. The specific dangers, I'm not particularly, I think those are pretty clear, but that's our goal.
This next question is from the Post-Gazette. What are the biggest issues about COVID-19, whether it's treatment, prevention, community spread, or the virus itself, that you thought you knew in spring that has changed since then, based either on the county's own experience or research and data around the country or world, or a combination of those factors?
Gosh, that's such a great question. I wish I had time to sit and ponder it for a while. I think lesson learned was that you really can't. This virus really can spread and replicate quickly, as we saw in the middle of June to the cases we saw at the end of June and the beginning of July. I think we've learned that the warm weather is not protective from the spread of this virus like we see with other viruses. I personally have learned a lot more about supply chain. As a physician, that was never part of my the words I used on a regular basis, but I learned a lot about the importance of supply chain, and both for PPE and for testing. I'll have to give that some more thought, and if I think of other things, I'll get back to you.
This next question is also from the Post-Gazette, and it's for the county executive. What impact do you think the inability of Congress to reach a deal to extend the additional $600 and employment benefits has on Allegheny County?
It'll have a significant impact, not just in Allegheny County, but throughout this country. We still have not seen the end of the economic impact that have affected so many people. We talk about our friends in the restaurant industry, the restaurant owners as well as the workers, and other industries that have been severely affected in the hospitality industry, hotel, travel, airline, et cetera, people in the entertainment business that rely on crowds coming forth to a theater, to a show, a performance, those things that have been hurt. So we've got to make sure that those people in those industries and the work there are also taken care of. So we're hopeful that the House and the Senate and the White House can come together. They may not agree on every other issue, but hopefully they can get relief for some of the folks that are out there. Let me also add to Dr. Bogan's comments regarding the schools. A lot of school districts have different plans. Some of them have the in-person, some of them have a hybrid, some of them have remote. And they've put a lot of time and a lot of thought in consultation with the health department, depending on what type of school they have, their buildings, the student body, et cetera, et cetera. The plans are solid plans. The issue is, will people follow those plans? Will the kids wear the masks? Will all the staff members? So the plans are only as good as the implementation and the cooperation of people, from the parents to the teachers, to the students, to the staff, of everybody doing what needs to be done. And that obviously goes to our colleges and universities as well. So as we go into this critical time, we really need people to be leaders, to be cooperative, to work together. Also, I want to answer the question about, what's the biggest change or what you thought. I think the thing that I've learned and quite frankly fear is how quickly this thing can get out of control. We started to see it in late June after just a couple of weeks of which we were doing extremely well, maybe better than any place in the state or any place in the country. And then very quickly it starts to take off. We don't want to see what happens in Florida and in Texas and in California and in Georgia and some of these states, and we haven't to this point. But it's only about cooperating that will do that. So I think a lot of us thought there'd be a little more time, at least I did, and as Dr. Bogan said, the hot weather might help us. That's not been the case as far as killing the virus and those type of things. So the speed at which this thing can happen can get out of control very quickly, and I think that's why so many of us are anxious about what could happen when we open the schools.
This next question is for both of you, one as a pediatrician and one as a parent of 8. How will parents, teachers, and other school leaders get the message through to students and children about the importance of wearing a face covering and enforced mask wearing, particularly among our teens and college students?
I guess I'll start, and then I'll defer to the pediatrician. As a father of 8, my kids are out of school at this point, but thinking and my wife and I talking about what we would do and how we would handle during those years, we really want to implore the parents to impart to their kids to follow the rules. That mask is important. It's important to protect your teachers, your coaches, your other students, and then coming back home. If you're not wearing your mask or somebody else isn't wearing their mask, and then you come back home, you could give it to mom and dad or your aunt or an uncle or your grandparents. And folks at the older ages are obviously going to have much more risk when it comes to their health. So, we need our kids to really step up, to really do something for their community. And so many kids are willing to do that. Kids go out, children love to serve and help their community. This is one way in which they can do that. Wear that mask when you're in class, wear that mask when you're around other kids, and hopefully, at least some of the activities can be as normal as possible.
Thanks for that question. I like to be reminded I'm a pediatrician, so that's good. So children are incredibly resilient. As a matter of fact, they're really adaptable. And so I think it's pretty easy if you can explain to children why they need to do this and you model that behavior, they'll follow that behavior as well. So we all need to model the good behavior, and our children will too. Again, they're very resilient and they adapt very well, again, with explanation. So.
This next question is from WPXI. The numbers appear to show more deaths occurring in long-term care facilities. How concerned are you that there could be an outbreak or further problems because of that?
Well, I am concerned, and we continue to see that we have outbreaks at our long-term care facilities. What gives me hope is that we have a much faster response now to when we see outbreaks happening. We have teams that go in and help them. Again, the state has developed a rapid response system to help them when there are outbreaks. We do continue to see them, and I worry that we will continue to have outbreaks, but our hope is that they will remain small, contained, and rapidly responded to.
This question is from Gazette 2.0. Schools are typically known as a hotbed for illnesses. Is it possible that coronavirus spreads like wildfire?
So interesting, I sort of think about the experience we've had in the child care centers. We know that there have been child care centers open throughout the pandemic. And we have not seen huge numbers of cases in our child care centers. And if you look at child care in general before the pandemic, a typical child in the first year in a child care center will get about 6 to 8 upper respiratory infections a year. And again, with mask wearing, with staff wearing masks, with kids who are older wearing masks, they've done a great job at limiting spread in childcare centers. So I hope that, again, if we follow all the guidances that have been put in place, and there's been so much careful planning from schools, that if they follow those guidances that have been put in place, we really shouldn't see enormous spread within schools, just like we haven't seen it in childcare settings. So that's my hope, is that people will adhere to the physical distancing, to face masks, to not sharing food utensils and things like that, keeping ventilation optimal as best we can. All that will reduce that from happening in our schools.
This final question is from WTAE. If schools go to all online learning, even if it's for a few weeks, what should they consider doing related to other external activities, not just sports, but things like marching band or other extracurricular activities after school?
I'm not sure I entirely understand the question that's being asked. Do you understand what they're...
I think the question is, if you're going to suspend school, should you also suspend marching band and other extracurricular activities as well, or can those activities continue?
Again, I think it depends on the activity, the size of the group, where it's going to take place. And again, I leave that to the schools who have given this. I mean, that's what they've been spending their whole summer planning, and they understand how the virus is transmitted. They understand the risks, and so schools need to balance that. They know their activities. Some activities certainly are lower risk. I talk about, tennis and golf compared to football and basketball, which are contact sports. Again, it depends on the activity and how you're managing it.
That was the last question.
Okay.
If you have any closing remarks.
And let me also, I think the governor also addressed kind of that last question about, I think his recommendation, I don't want to misquote him, but I think it was something along the lines of, if you're not going to be in school, it's going to be tough to have other extracurricular activities in the same school. But each district's going to have to make their own decisions, as Dr. Bogan said, based on the recommendations, based on their spacing and all the things that they can do. It's, again, to see the numbers this week, as Dr. Bogan talked about, and I mentioned it early on, we've seen improvement, and it only happens because, so many people are cooperating. You can see it just walking on the streets or just going to different places. So many people are wearing their masks, which is excellent. That's, you're helping your community, you're being patriotic, you're doing the things that you can do to protect your neighbors, to protect your friends and coworkers and folks like that. So we want to continue that. Again, we've got some challenging times ahead as school opens up. We want to keep those numbers heading in the right direction, but it only happens if we continue to cooperate. So let's continue to cooperate, continue to wear our masks, keep social distancing, and let's